How would you like to cure diabetes and at the same time transform your practice and improve its financial health? You are listening to ReachMD XM160, the channel for medical professionals. Chronic diseases such as type 2 diabetes and heart disease have reached epidemic proportions, costing $1.5 trillion annually. Despite the fact that therapeutic lifestyle change programs have been effective in preventing, managing, and even reversing many chronic conditions, few health professionals offer TLC programs. Welcome to the Business of Medicine. I'm your host, Dr. Larry Kaskel. Joining me today is Mike Katke, Vice President of Medical Marketing, co-founder of Metagenics, Inc., and creator of the First Line Therapy, Metagenics' own therapeutic lifestyle change program. Mike, welcome to the show.
Thank you, Dr. Kaskel. Nice to be here.
Well, let's start with first, what is a therapeutic lifestyle change program?
A therapeutic lifestyle change program is a program that's implemented by a health professional that helps patients really look at what they're doing in their own self-management of their health. And since many of the chronic diseases that we're experiencing, even as epidemics today in our society, the underlying cause of many of these conditions is people's unhealthy lifestyle habits, it's really incumbent upon health professionals today to address that in a clinical setting.
Mike, what kind of evidence out there supports the claims that TLC actually will help prevent, manage, or reverse chronic diseases?
You know, the scientific data has been building on TLC for a number of years. In fact, so much so that there's now a new medical specialty group called the American College of Lifestyle Medicine, founded just a few years ago specifically to help physicians to incorporate therapeutic lifestyle changes into clinical practice and to learn more about it. So the data is actually quite overwhelming at this point. It's the most cost-effective approach for many patients, and it really addresses underlying causes of many of the chronic problems patients have.
Well, let's dive into the underlying causes. As far as I'm concerned, it's the white devil. Sugar, refined carbohydrates, pasta, rice, you name it, anything white is bad.
That's a very good point, a good way to look at it. People have moved to white diets, white and I'll add a little bit of brown in there, and we need to move more toward the colorful type of diets that people have eaten in the Mediterranean type diet that's been quite well researched and shown to be preventive and even therapeutic with many of these conditions, and it's just not what people are eating here in the United States. And as people learn about these things, they learn how to do the right things. It becomes not such a daunting task to make these lifestyle changes. So it's really an educational process, and we've somewhat miseducated our population in thinking fat was the culprit. It's really not just about fat. It's about the quality of the foods that we eat, the processing that they go through or lack thereof, very important issues.
I think you hit it on the head. We've been taught and propagated this myth that cholesterol and fat are bad for you and are the cause of every evil, when in fact it's always been sugar and insulin, and big business still continues to push these myths. And until the doctor recognizes that, almost the wool is being pulled over his eyes and realizes what helps patients lose weight and improve their life, we're still going to be doing the wrong thing. And so here you have this program which seems incredible, and yet few doctors are doing it. Why do you think that is?
Well, it's somewhat early on, but doctors have not been trained in therapeutic lifestyle changes in medical school. It has not in the past been a part of their training. Doctors don't have time in modern healthcare today to do this kind of work in many cases, and the financial structure has not been there to make it possible for them. So basically, we've been working with those specific issues and tried to develop a program that would help save doctors time, help them to deliver quality lifestyle change information and support to their patients, giving them the hand-holding that they need, and yet do it in a financial model that makes it feasible for them to deliver it on an ongoing basis.
So you're in San Antonio right now teaching a course this weekend on first-line therapy. Who attends these courses?
We get a very broad mix of health professionals, from medical doctors, osteopathic physicians. We get chiropractors, naturopathic doctors, nurses, dietitians. We get the full spectrum of health professionals.
And what are you teaching them, both in terms of science and how to implement it once they get back to their practice?
Well, we give them the scientific basis for the work that we're doing, and the literature is quite full of that kind of information. We also give them controlled clinical trials that we have done in our own research center and with our research team on this specific program, comparing it, for example, to a low-fat approach. American Heart Step 1 diet was one of the controls we compared against, or just other forms of programs that are common out there. And so we show them that data. And what we teach is a system. We find that if it's not really a part of the in-office system, a part of what physicians do as part of their everyday work, then it's going to be left to the side in most practices and not implemented with every patient that needs it. So it really has to become part of the office flow, a part of the regular system that's implemented within a practice, and we teach practitioners how to make that happen in their own setting.
Well, I got to tell you and the audience that I attended one of your courses 4 months ago, and I have instituted a TLC program in my office in October of 2007, and we've been doing it for about 4 months, and I am blown away by the results I've seen in my patients. We've been able to actually cure patients of their diabetes. We've been able to get people off their diabetes medicines. We've been able to get people off their high blood pressure medicines. And the people are thrilled. The staff is almost amazed that they finally have found a tool that helps them not only take care of patients, but actually make a difference. And then additionally, we're in an economic downturn. It has dramatically improved the financials of our practice. There were practitioners, nurse practitioners, physician assistants who had open spots. Now they are completely full because of this program. And so I think it is amazing.
That's fantastic, and I can't hear that often enough, so feel free to keep saying it. I really appreciate those comments, and we find that your experience is not uncommon, and not only is it financially rewarding, and it's very professionally rewarding. People really say they're having a lot of fun in practice doing this kind of work now, because they're really helping patients in a deeper way than, in many cases, they've had time to do in the past.
If you've just tuned in, you're listening to The Business of Medicine on ReachMD XM160, the channel for medical professionals. I'm your host, Dr. Larry Kaskel. I'm talking today with Mike Katke, Vice President of Medical Marketing and co-founder of Metagenics. And we're talking about how to implement a therapeutic lifestyle program within one's practice. You know, I talked about my own practice, but Mike, what do you see as the optimal staffing requirements for implementing this program? Do you usually just use existing staff, or does a physician's office have to hire anybody?
Well, it can be done either way. Many offices use existing staff, and it depends on how busy those individuals are. If they do have extra time, then an existing staff member is often a great person to use. If your existing staff is already pretty much buried, then it's necessary to get someone else to do this kind of work, because if the prescribing physician prescribes the program effectively, you're going to have a busy person.
Exactly. They are busy, and we're already looking for someone new. I'm sending someone off to train at your next course to become a lifestyle educator because it's so popular. And what's interesting, though, is I want to stress that it's not a diet. It truly is a lifestyle change. And when I go to lectures, given by pharmaceutical companies, and they present a case, they always say TLC was attempted and failed, so thus we added on 20 million different drugs. And before I did this program, I never really knew what TLC was. And you actually give a turnkey operation to the doctor's office to really do TLC, not just offer it to the patient, not just say, here, you know what, try this for a few weeks and come back. This is a structured program that takes 3 months, and you go on. Tell me the rest of it.
Yes, it is structured, and it really gets down to the issues with each individual patient. We will have a person designated as a lifestyle educator. You're using nurses in your office, I believe, and it can be a nurse or whoever it is that's designated with that job. They sit down and really address the issues for the individual patient. How can they make these healthy habits a part of their regular lifestyle? And it's a negotiation and an educational process. And then they do follow-up visits with the patient to make sure that they get it and that they stick with it and they remain on track. And we find that it's not a diet. It is not a restrictive approach. In fact, we require that people eat frequently. Many patients find they have difficulty eating as much food as we recommend on this program, but because the quality of the food is different, people lose weight on the program, and their parameters, as you were mentioning, diabetes, metabolic syndrome, blood pressure, blood lipids, and blood sugar, on and on, they all improve when people implement these appropriate dietary and lifestyle changes. So it's a specific methodology to deliver this information to patients in a way that they can make part of their daily life, and we find a way to make it work for them every day.
What's also interesting is even before they lose a large amount of weight, and that's really not the thrust of the program, they're coming in after 1 week. And they're all feeling better. And I think that's because we've regulated their blood sugar and their blood insulin levels. They are truly finding more energy after being on this program for 1 week.
Yes, the most common comment we get from patients is that they feel so much more energy. That's the number one issue that comes up for people that they experience first. And then secondly, it's the risk factor improvement before the weight comes off. One of the things we focus on is to improve muscle metabolism, to maintain muscle, and we track body composition to make sure that people are gaining muscle or maintaining muscle. And we find that when people improve the integrity of their muscle and metabolism in muscle, then weight loss follows. So it's not a weight loss program, but for most patients, if they are overweight going in, weight loss is a pleasant side effect for them.
This is the business of medicine, so we got to talk a little money on this show. I'll tell you, my personal experience is that we've had 129 patients do the program from start to finish, and it has averaged for 7 visits that each patient, plus or minus a few dollars, we've been able to generate an additional $1,000 per patient. So for 1 quarter of the year, we've brought in another $129,000. And we're not a big practice, so if you multiply that times 4, you're looking at an added revenue of $500,000 a year. Is there any reason under the sun why a doctor would not want to do this program?
I really can't think of one. It's definitely the right thing for patients. There are many patients who are looking for alternatives. Many docs are getting pushback on medications these days. There are more and more patients that would like to manage their health without medication if they can. This gives the doctor a real option for patients to do that and create a significant revenue stream at the same time.
I also think you should, Mike, you should be talking to the new administration. A diagnosis of diabetes, I think the numbers are it adds on, it subtracts 12 years of your life, and I think it increases medical costs $12,000 a year just having that diagnosis. And if you can actually prevent or cure this disease for $1,000 a patient, I think the government should look very hard at TLC programs.
Yeah, I completely agree with you. And interestingly enough, in the last few weeks, apparently Obama's group has done some surveys of physicians around the country, and we had several of our users of this system asked to come before government officials and talk about what they're doing in clinical practice and talking about the future of healthcare. So this is on the radar screen. I don't know if our program is on the radar screen, but therapeutic lifestyle changes are definitely on the government's radar screen as a way to reduce healthcare costs and improve the health of the population.
Do you have any problems in terms of getting these services paid by insurance companies or Medicare?
No, we do not. Insurance billing is totally appropriate for these services. In fact, we've seen reports that some of our physicians are getting back from insurance companies where they actually flag patients and say to the physician, this patient is a candidate for TLC.
Wow.
And so the insurance companies are very strongly encouraging this because they know this is going to save them money as well, and it's in the best interest of the patient.
Mike, we're almost out of time. I want you to pretend you're in an elevator and you run into a cynical primary care doc. I want you to give him your best elevator speech to tell him that it's in his best interest and his patient's best interest to put a TLC program in his office.
Well, I would say, Doctor, the multiple national health organizations have been calling for physicians to become involved in therapeutic lifestyle changes with their patients as a first line of therapy for many common chronic disorders. Many doctors have not done that because they don't have time, they don't have the tools to do it in clinical practice, or they can't make any money at it. There are ways to overcome those problems, and when you do that, it can not only be the best thing that ever happened to the patient, it can be very, very profitable, I guess I should say, for the clinician.
Well, Mike Katke, thank you very much for coming on the show today.
Thank you very much for having me. Appreciate it.
Mike Katke is Vice President of Medical Marketing and co-founder of Metagenics, Inc. He also created the First Line Therapy program, which is a customized therapeutic lifestyle change that you can use in your office, and he comes to us today from San Antonio. I'm Dr. Larry Kaskel, and you've been listening to The Business of Medicine on ReachMD XM160, the channel for medical professionals. please visit our website at reachmd.com, which features our entire library through on-demand podcasts. And you can now call us toll-free with comments or suggestions at 888-MD-XM160. And thanks for listening.